Hello again, and welcome to the Parkinson's Foundation Mental Health for Care Partners webinar. I'm Nancy Nealon, one of the community program managers for the Parkinson's Foundation. And joining me today from behind the scenes are my colleagues, Erin and Danielle. Erin, Danielle, and I warmly welcome all of you to the webinar, especially anyone joining us for the first time. We are also very honored to help kick off programming this month, which is designated as Family Caregiver Month. Just a quick note again as we begin, we know we share a lot of information during our webinars. Don't worry though, you won't miss a thing. You can sit back and enjoy and take in all the content because you will receive an email from us in about a week with a link to the recording of the webinar and any slides that we use. If you're joining us for the first time, I'd like to share with you and take this opportunity to share the mission of the Parkinson's Foundation. We make life better for people and their caregivers, people living with Parkinson's, by improving care and advancing research towards a cure. We have everything you need to live better with Parkinson's. To achieve our mission, we pursue three goals: to improve care for everyone with Parkinson's disease, to advance research towards a cure, and to empower and educate our global Parkinson's community. And we do all of this by building on the energy, experience, and passion of our global Parkinson's community. The foundation has a vast number of resources available for you to access. Please think about taking advantage of any of the books that we publish, our Parkinson's Foundation helpline, education events such as this podcast, our hospitalization kit, the Aware and Care Kit, our centers of excellence located throughout the country, and so much more. I encourage you to call our helpline, 1-800-4PD-INFO, or visit our website, parkinson.org, to learn more. And we'll give you those numbers and information again during the webinar. One example of our mission in action is PD Generation. This is one of the largest research initiatives launched by the foundation, focused on the role of genetics in Parkinson's. To learn more about how we are committed to advancing Parkinson's research, visit parkinson.org/PDGene. We also need your input. We've recently launched PF surveys. This effort is focusing on capturing our community's perspective on various topics, including mental health, telehealth, cannabis, and the list goes on. I encourage you to consider registering to participate, and this is for both people with Parkinson's and for care partners. By signing up for this initiative, we will email you up to 4 times a year requesting that you complete a 10 to 20 minute survey. Your input, especially as a care partner, is a necessity to help inform our work going forward. I'd also like to let everyone know, if you haven't taken advantage of our PD Health at Home program, I'd like to encourage you to visit parkinson.org/PD Health to find out about the programming we do 3 days per week. And don't miss the next Care Partner event this month, which is a Care Partners Town Hall on Wednesday, November 17th. So it's a lot of information about the Parkinson's Foundation, but I want to reiterate that we are here for you. To learn all about what we have to offer, visit parkinson.org. You can call our helpline at 1-800-4PD-INFO. You can email our helpline at parkinson.org. Today, I would especially like to recognize our sponsor. I'd like to acknowledge Curran, today's webinar sponsor. On behalf of all of us at the Parkinson's Foundation, many thanks to everyone at Curran for your wonderful generosity. Thank you for your willingness to support our vital mission. So now we're getting on to the actual webinar and our presentations. And first, I'd like to introduce to you one of my colleagues, Ann Wallace. We're also used to calling her Annie. Sorry, Ann. I probably will refer to you as Annie. Annie is an MSW, Master's of Social Work, currently serving as our Director of Education for the Foundation. As part of the Education and Training Department, she oversees the Hospital Care Initiative, that's part of the Aware and Care Kit, including the Aware and Care Program and the Care Partner Program. Annie completed her Master of Social Work focused in community and social justice from the Ohio State University, and her BSW or Bachelor of Social Work from Florida State University. She is passionate about empowering diverse communities to achieve their best health and social outcomes. So with that, we're going to take down our slides and bring Annie onto camera.
Hello, everyone. Can you hear me all right?
Thanks, Annie.
Thanks so much for the introduction, Nancy. It's wonderful to be here with over 200 care partners. You all do such incredible jobs caring for your loved ones with Parkinson's, whether they are newly diagnosed or living with advanced Parkinson's or anywhere in between. So I am here today to give a short demonstration on the Care Partner Program, which offers a series of online courses designed for Parkinson's care partners. We currently have 8 courses available in English, all of which are designed to be taken at your own pace. So you may sit down and complete a course in a single sitting, or you might complete a little bit at a time over a month or even 2. The videos are short with reflection prompts throughout to make sure that you are thinking through how each topic impacts you personally. So now I'm going to share my screen and show you what it actually looks like. So what you're looking at here is the landing page, which is parkinson.org/care partner program. And if you haven't registered for the program, you would click register here. And as you can see, you can put in your name, your email address, etc. I already have an account, so I'm going to click that. I've got it all set up and I'm going to click sign in. So because I'm registered for the full bundle, meaning all of the courses available through the Care Partner Program, here you'll see all 8 courses if I go to page 2. The added benefit of registering for the bundle is anytime we add new courses, you'll be automatically enrolled. And don't worry, we don't expect you to complete all of the courses just because you're registered for the bundle, although you're welcome to. But this page we call your learning dashboard, and it's your own personal page with all of the courses you've registered for offered through the Parkinsons Foundation. So we have this program, the Care Partner Program. We also have a cognition course for the Parkinson's community. So if you were registered for both, they would both show up here. Now, we recommend if you're going to get started with the Care Partner Program that you start here with the Welcome course, which has some really short videos that walk you through what to expect, how to navigate the platform, and there's a survey that's going to help us understand who's participating. But today I want to show you a sneak peek into our most popular course thus far, this one here, What is Caregiver Burnout? So as you can see, you click on it and it launches right away with a little video. And I'm not going to continue. I'm just going to show you around a little bit and give you an idea of what to expect. So if you look on the side, it's on my left, this is essentially your table of contents for the course. So you can see all these different sections. You are, of course, welcome to jump around throughout the course. However, we think you'll probably get the most out of it if you start at the beginning and work your way through. So in this first section, Caregiver Burnout and Strain, our expert social worker gives a short introduction to burnout and strain here in this video that I've clearly already watched. So if you've already watched it, it picks up where you left off. But you'll come here, you hit play, and you can hear it from Lance. And then after we hear from our expert, in each of these sections, you'll see something a little bit different. So here we have a tips section where you can see some excerpts on managing caregiver stress from our Caring and Coping workbook. So you can read through it in here. You can take a look and see, oh, okay, so it's pages 30-ish to 35. If you have your own copy of this free workbook, you can pull it out and look at it in physical form. You can pull it up on the website. We have this available there. It's also available in Kindle format. Or if you don't think that this is relevant to you, or you'd rather focus on other sections, you can just hit this continue button. That'll take you to the next section. And each of these sections wraps up with a reflection prompt. So here we're encouraging you to take a moment and reflect on how you currently manage care partner stress, and consider whether there are any new techniques that you'd like to add, like exercising more or focusing on your breathing or body awareness. So this course goes on to cover additional topics like how to seek respite care, especially when you're on a tight budget, how to recognize caregiver burnout, prioritizing your needs, and more. And when you get to the end, the very, very end of each course, let's see, we've got our final thoughts section, which includes a course evaluation. So this is especially important for us so that we can learn whether the content we're creating is positively impacting your life, which is obviously the whole point. So any feedback is welcome. If you love it, if you hate it, if you think it's great but could be improved, please let us know. And we are continuously working to improve this as we add new courses and tweak the courses that we have available. So if you haven't registered yet, you can do so today at parkinson.org/carepartnerprogram. I'll send that out to everyone in the chat right now. But I don't know, Nancy, if we've got time for any questions or if you want to hold those to the end. But I hope that you all will go in and take a look, see if any of these courses are relevant to you. And as I said, please let us know what you think.
Annie, we do actually have a really important question, so let me move next to that. For this particular service, do we charge a fee for this?
Oh, that is so important. We do not. This is a free service. The courses, like I said, you go at your own pace. If you start a course and you say, I don't think this is all that relevant to me, you can stop taking it and move on to another one. You can jump around. Our goal is for each of these courses to be easily completed within an hour. The caregiver burnout one went a little long. It's probably more like an hour and a half. If you sat down and did it all in one sitting, which we know almost no care partner is going to be able to do. So spread it out as long as you like. We'll send you little engagement reminders every month or so. And like I said, totally free. So sign up, share it with any other care partners you're connected with. If there are any secondary care partners who are helping care for your loved one, there may be things they can learn as well.
So it really could be, anyone could check these out. There's no
Yes.
stipulations on that.
Absolutely.
And if a care partner went to the site, was signing up and all, if they're having any difficulty, if they have questions specifically about this, what should someone do about that?
So as it is outlined in that welcome course, there's an email address that you can reach out to. I think it's carepartnerprogram@parkinson.org, which essentially comes right to me.
Oh, good.
So if you're
Okay.
having any trouble, please let us know. One thing that we do sometimes see is that it sometimes works a little bit better on Google Chrome than it does on Internet Explorer. Sometimes people get frustrated because the videos aren't launching right away and you have to hit the button. So there are some little technical things that are sometimes a little irritating that you just have to get the hang of. But please reach out. And like I said, let us know what you think. If it's too complicated, if it's too confusing, if we need to simplify it, that's important feedback.
Yeah, that really is building on our global community for us to get that input and feedback to make it better, to do whatever. I mean, it's a huge undertaking. And hold on one second, there was another question. Let me just get back to it for a sec. Sorry, it just went somewhere else, but I'll find it. Oh, so just quickly, I know that there are a lot of topics in this course. Do you explore, do you do anything on dementia?
Ooh, yes, we do. So we have two courses currently focused on cognition. One that's focused on early cognitive change, but the other is titled Cognitive Changes on a Continuum. And it's led by Dr. Joe Quinn, who's an incredible movement disorder specialist focused on cognitive changes in Parkinson's. And he talks about the full range of experience of cognitive changes in Parkinson's, from mild to severe, which of course is where we start talking about dementia.
Okay, great. So people will be able to get information. That's always,
Yeah.
we hear that, our helpline hears that all the time. Of course, people have
Yes.
lots of questions. So,
And within that course, when he talks about dementia, he does also touch on psychosis and hallucinations and how that can be tied to it. And the other thing in all of these courses that I meant to mention and forgot to is, in addition to the expert, we also have clips with care partners. We brought pairs of care partners together to talk through some of these issues. So, in the cognitive changes on a continuum course, you'll hear from care partners from all along the continuum dealing with the cognitive changes of their loved ones.
this is probably a good time to mention there might be some individuals, our attendees today, who perhaps are in support groups and other care partners. Please feel free to take the message about our online course and share it with people in your support groups. Let other people know, help us word of mouth to promote this. The more people who use it, obviously, and as Annie said, that's the whole point, is to try and assist as many people as possible. So with that, thank you so much for joining us today. I know you would love to stay, but you actually have another meeting that you have to go back to. So thank you for stepping away from that and being with us. And once again, to everyone attendees, please check this out. This is so important, so valuable for you. So thanks so much, Annie. Truly appreciate you being with us today.
Thanks so much, guys. Enjoy the rest of the program.
So with that, that's the first part of our webinar. And now we're going to switch gears a little bit and start talking about mental health for care partners with specific people. And I'm really delighted at this time to be able to introduce our next panelist. And she is Dr. Elizabeth Santos. And I'm going to wait until her camera's going to come on in a minute. And then I
should be on.
Okay, there we go. You are on. Excellent. It's probably the view that I have going on here. So welcome, Dr. Santos. We are just so honored and thrilled for you to be with us. So let me tell everybody a little bit, give them your professional bio here. Dr. Santos is an associate professor at the University of Rochester School of Medicine and Dentistry. She is a director of Geriatric Psychiatry Fellowship, the fellowship program, and the university's Behavioral Health Older Adults Clinic. She's also the medical director of the Memory Care Program, a nursing home consultant, and is an attending physician at Strong Memorial Hospital Comprehensive Psychiatric Emergency Program, and that's the university's teaching hospital. Her research focuses on elder abuse and neglect, training evaluators, and advocacy for older adults. She is the geriatric psychiatry consultant on a National Institute of Justice funded enhanced multidisciplinary team focused on financial exploitation, as well as a member of the New York State Coalition on Elder Abuse. Dr. Santos, having said all that, we are even more grateful for you to be able to be with us today. So thank you so much. Thank you. Thank you. Your credentials are just incredible. And I think for our purposes today, I would love to start next with just a couple of questions, and maybe can you tell our attendees, we have well over 200 people, 200 care partners from across the country. What is it exactly in the world of mental health for seniors? What do you do?
So I am a psychiatrist by specialty. So, went to college, then medical school, and then to become a geriatric psychiatrist, you do 4 years of general psychiatry training to take care of adults in general. And then I happened to do a 2-year interdisciplinary geriatrics fellowship. This doesn't exist anymore, but when I did it was with geriatric medicine and dentistry and psychiatry. And then I went on to actually do a master's in public health. And I'm actually, what you read must be a little bit old, because I'm the clinical chief for all the divisions, for all the clinical services. And so, part of my goal, my personal goal in doing all of this work is really to help people kind of age in place. A lot of what I do is try to help people live the way they had wanted to live. Most people do not anticipate that they're going to, die in a nursing home, right? Nobody says that, eventually, yeah, that's where I want to be. No one can take care of me. And so there are a lot of ways that people end up in nursing homes, and some of those things have to do with mental health specifically, for the care partners and also, the care recipients. And in fact, we're all kind of care partners, right? We all care for each other. Right. So it's where do you make that distinction is different.
And for our purposes of our discussion today, certainly as Parkinson's is a focus, we aren't going to the point, but certainly care partners can have their own physical challenges as well. But I guess the wonderful thing, and we were talking about this before we went live, is we are so happy to be able to bring to the forefront and bring out in conversation just mental health in general. We focus a lot on the impact of all the physical parts of Parkinson's, but there can be a significant cost to the care partner's mental health that we want to talk about today. So could you, this might seem so obvious, but as a practitioner, as the expert, why is taking care of one's mental health as important as taking care of one's physical health?
Okay. Well, it's a complicated question, and I think we're in a better position to answer that now than we were when maybe I started training over 20 years ago. You kind of alluded to it. There's a stigma, right, in people thinking that they need help. People ask for help easily, or more easily, I should say, if they fall down and they broke their arm or something, or they broke their leg. But if you somehow falter and you need help, getting up in the morning and it's not due to the broken leg, people have a much harder time accepting that kind of help, and I have a lot of people that see me and it's really late. I wish they had seen me 5 years ago. Just the people I saw this morning. I think there's definitely a difference. So 20 years ago, when I chose to go into this field, I think people didn't talk about it as much. It was a little bit better, and sometimes I thank Oprah and Dr. Phil and whatever, not exactly the way I operate, but at least people are talking about it. And I would say COVID helped in some ways, because there are more people admitting that, we need help. We can't do everything on our own, no matter what it is. We all need people. And if you are a care partner and you feel like somebody's relying on you for everything, right? Now this could be even if you're a mom, right? I definitely experienced this in my own life, right? Sometimes you just want to pull your hair out, right? You could be doing everything by whatever book you're reading, and you just feel like you can never do anything right. Sometimes you need help just to get some perspective, right? I'm drowning in the everyday. Does somebody see that I'm drowning, or is it, am I doing things right, or is it just me? Sometimes people come to us just for a consultation. is there something wrong, or is there really nothing wrong? And sometimes I'll say, you know what? No, I think you're doing everything great that you can. What is it that you're having issues with? I was just talking this morning with a lovely woman whose husband passed about 5 years ago. And, she's supposed to be over it right now, right? She's not, she has grieved. That's what she told me. She's grieved. Well, what does that mean? It's not always the same for everybody. We have very complicated, relationships with each other. And it stems from what our relationships are with people in the world, your family, what your parents did for your grandparents, all of these things, what your expectations are. And a lot of times we don't take the time to breathe and think about it. And those kind of things can leach out in our current relationships. Things that happened, maybe not even to us, that we witnessed between a relationship between our parents and their parents. And resentments will come out, and things that you beat out yourself up for, and you don't have time to deal with it. If you don't have time to deal with it, and you don't take the time, we have lots of evidence, right? That kind of stress weighs on us, right? Caregivers don't take care of themselves most often, right? We've got tons of research that says you don't go to your own doctor's appointments, right? You change everything for the person you're caring for. It's their appointments. You may not even pick up your medication because you're just so busy you don't have time. At 1 o'clock in the morning, maybe that pharmacy isn't there. If we don't take care of ourselves, then who's going to take care of the partner you're caring for, right? And that's often how I can work with care partners to get help from themselves. Because once you start thinking about, geez, this is domino effect. If something happens to me, who's going to care for him? Who's going to care for her? Who's going to care for them? I do need to take care of myself now. I hope that answered some of your questions.
Absolutely.
Going off.
No, it's okay because, there's so much here for us to talk to, and we're going to accomplish a lot in an hour. But one of the things that you said about, the care partner doesn't even have time to pick up their own medications. We've done a lot of work, I think, to talk about care partners taking care of themselves. But I don't think that, I think this is just the beginning of us expanding that to both the physical needs of the care partner and the mental health needs of the care partner. So thank you for helping us break ground on this today. This is so important. And at this point, we'd like to involve all of our attendees. We're going to do a quick poll. We'd just like to have you weigh in on a question about what have you tried? And there's certainly many other possibilities here. These are just a few, but give us a shot here in terms of voting. What have you tried when you try to relieve your stress? And there, as I said, could be many others. And Dr. Santos, let's just take a look at some of the results here. We have a lot of people online with us, so I'm going to give it just a few more seconds. And clearly calling a friend, that does make a lot of sense, doesn't it? The human to human support and interaction. So calling a friend is definitely what I'd love to see, though, that 31% of folks who are tuned in today have sought help from a counselor or a therapist. So bravo, that is just wonderful. So with that, we are also very honored. I'd like to introduce at this time 2 care partners, and they're going to tell you a little bit about themselves. And we're going to involve them in our panel here. So at this time, Richard and Lola are going to join us. Thank you both for joining Dr. Santos and myself. So thrilled to have you with us. So Lola, how about if you could just tell folks, just give us a little snapshot of your care partner situation.
Yeah, I actually have both a personal and a professional experience to share. Personally, my father has Parkinson's. He's been living with that diagnosis for about 8 years, and I'm proud to say he's doing really well. He still lives with my mother. They're married. And professionally, I work in senior housing. I have a social service role, and there are often many people in our building that are living with Parkinson's. And so I have the added advantage of seeing how other people do it.
Oh, yeah, absolutely. Absolutely. Great. Thank you so much, Lola. Richard.
Thank you for this conference. This is amazing. Glad to be here. My experience with Parkinson's is largely with my care partner, my wife, Chris, has had Parkinson's probably for 8 years and diagnosed about 5 years ago. You know, they say that's a snowflake disease. Everybody is different, but she's, you know, she has good days and bad days. I can see the progression of fatigue, and there are some gastrointestinal things that are come on with Parkinson's. But from the mental health perspective, she's an incredibly resilient person. She's a lawyer, has lived a very good life, and is very active too. She's a master gardener. So on those good days, she can engage in those activities, but she can't do as much as she used to do. And that's frustrating from a mental health perspective. And I know everybody is a care partner knows that experience. So myself, I've been in healthcare I was an executive in healthcare for 34 years and have a very, very close, like Lola, very close classmate from college that has Lewy body syndrome and Parkinson's disease and is a nursing home. And I don't expect that he's going to have much time left. And it's a challenge to be present. That's important. But mentally, it's hard when you see what the progression could be in this, what I call snowflake disease. So.
Absolutely. And that's such an important point to make sure that we reiterate that no two people with Parkinson's are alike
Right.
in the disease progression. So caregivers have that challenge as well. But for Lola and Richard, and Lola, I'll start with you again. When you think about care partners and their biggest needs in relation to mental health, what do you think that biggest need is as it concerns mental health for the care?
Yeah, I actually think Dr. Santos hit it right on the head. At least I really connected with those thoughts, because it's about not just worrying about the person in your care, but also giving yourself permission to take care of yourself. I find that I have to forgive myself. That it goes that deep sometimes, where I am just so focused and feel so responsible for this other person, that I have to give permission to myself to be okay with what we're living in.
So in dealing with the guilt and the impact that can have on you. Okay.
Yeah.
Richard?
Yeah.
Richard, what do you think is the
just-
biggest mental health need for care partners?
I don't know that I can put it into one thing. I like what Lola said though, because put your oxygen mask on first. You have to take care of yourself to be a good care partner, and that's definitely true in my case with Chris. I said, you know, to me, it's this progression of acceptance, accepting what is. I guess maybe this is, I don't know if this is a male trait or not. I have a tendency to want to fix it, and my wife reminds me I can't fix it. So accepting that. Finding balance in her life and my life so that we can enjoy good days and productive days and accept the ones that aren't so good. I think finding calm, the stress that can build up with, my son who lives with us, fortunately in graduate school, we cook all the meals, we do a lot of the housework, you know, and there's more added duties. The stress of that, finding a calm oasis in the middle of that time is so important. And I think, it's companionship. Was it a mental health need? But I think, as the poll suggested, having a companion you can talk to is not necessarily your care partner, because there are things that you sometimes need to talk to another person. So having a good companion that you can confide in, and I'm very fortunate to have a number of good male companions that are willing to sit down and say, when they'll tell me, they say, "You look pretty stressed. We need a lunch."
Yeah.
That's really
Yeah, that is such a great segue, because I'd like to ask Dr. Santos a little bit about this. Dr. Santos, from questions submitted through the registration process, and certainly I know that they have come in here, people are really hurting in terms of Parkinson's. For some people, this is not true for everyone, but for some people with Parkinson's, they can experience delusions, hallucinations. They can have some impulse control symptoms, might think that their partner is cheating on them. There's a lot that can impact the intimate partner relationship, the emotional partnership, partner relationship. There's a huge toll on the care partner's mental health. Can you react to that, in terms of providing some advice, suggestions for care partners dealing with all of that?
Well, there's so many things I could react to there. Yeah, I better keep notes of the thing. Well, okay. So if we're gonna just break it down and talk about maybe psychosis, because that is another reason, I as a geriatric psychiatrist do see a lot of people with Parkinson's disease, even though people don't want to say they're crazy or whatever. Know that it's not normal, and don't fight with the delusion, right? Don't try to convince your partner. Don't waste the energy. Delusions, in fact, are they're irrational thoughts. They are thoughts that are not logical, right? And so you're not going to fight them with logic. So you spending a lot of energy trying to convince him or her that you're not cheating, or that there wasn't a party going on that they weren't invited to, or whatever it is, right? That they're seeing or hearing. The first thing to do is try to distract them. The next thing to do, and get off the topic as much as you can, is to tell their doctor, right? Because all of the physicians who take care of anybody with Parkinson's disease know that psychosis, right, it can be part of a result of some of the treatments, right?
Yeah.
That's why, unfortunately, we're giving dopamine, right, to people. But, psychosis is, at least the dopamine theory of schizophrenia, is that there's too much dopamine. And so the medications to treat psychosis are dopamine blockers. And it's a really delicate balance in how you use them. We don't always use them. We don't always treat illogical thinking, right? You can live with delusions and hallucinations as long as you have ways to cope with them, right? But it can put a big strain on the relationship, especially
Yes.
the ones where there's like some kind of romantic thing. Oh, you're cheating on me, or even though you're there 24/7, right? I mean, you're not even gone anywhere. I've had people who have actually hired private investigators, right, to prove that they're not going away somewhere. So talk with a doctor. See if you do need to have some kind of medication for them that you can treat, right? Don't try to hide it. Don't be ashamed of it. I think when a diagnosis happens with Parkinson's disease, there's so much that happens in those initial meetings and starting medication. You may not remember that they probably told you that some of the medications can cause psychosis, right? So ask. Always ask if there's something that's going wrong, and don't be embarrassed by it. I have talked with some people that think, well, maybe there was some cheating before, and the family member. This actually is a patient that I have where she feels so guilty that there was some kind of cheating before, and thinks that her husband is remembering all that, which can happen whether there's cognitive issues and stuff. And so it's kind of reliving those eras. And she feels so guilty from the time before that she doesn't want to tell anybody. So, it's all individual, like Dick and Lola were saying, it's the snowflake, absolutely. So ask us if there's something we can do to help. Please ask.
All right. One of the things, and this has come up frequently, and we have a question, and I think it's a great question from someone who's tuned in today, is what should I look for when trying to find the right therapist to assist me as, a caregiver who's really beyond strain? It's a caregiver burnout. What's the best advice? And we have links that we're going to share. And once again, folks, you don't have to worry about copying down all these links. We're going to send these to you. But Dr. Santos, how do you find the right therapist? It's, not only how you interact with therapist, but gosh, you want someone who has some knowledge of what all of this is like. So how do we tell people to find that therapist?
Well, finding a therapist is really individual, right? You cannot tell by the CV. They could have like, or the resume. They could have like this great thing, and they've had, many people who've had Parkinson's disease in their care, whatever. You really have to meet somebody. And I would say, give it 2 or 3 times to talk about it, and be very open with your therapist. There are thousands of therapists, right? And I tell people who are working with me too, might not be the one. It could be something that, my voice annoys you, or something. There could be something that there's nothing that you and I can control, that there's something about me that rubs you the wrong way. Be honest with your therapist if you're trying them out. Like, this is what's happening to me, or, I don't like it when you say, don't try to please people. You're trying to if you're taking the step to find a therapist, right? You got to be a little mercenary about it, right? You do. Don't waste the time. I want to talk with you for 2 or 3 sessions, see if this is a right fit. I'm going to be very honest with you about things. Like I said, it could be something that they can't change. The pitch of the voice, where they live, what they look like, that you can't tell by the
Right.
And don't beat yourself up or the therapist about it. It didn't work. Try somebody else.
Right.
Okay. Dr. Santos, could I just inject a thought and get your response? Having had some therapy in my past and gone through some marriage therapy many years ago, there are therapists that I know that I really trust. I don't know if they're expert in Parkinson's, but I might go to them and say, kind of, here's what's going on. Who do you know? It's like finding someone, you said it so well, with the chemistry and the trust that you can rely on, and say, is it possible you could go to someone you might know and say, here's what's going on. Who do you think, do you know someone that's also good at Parkinson's that I could work with?
Oh yeah, I absolutely agree. I mean, just put it out there for anybody you know that's had a therapist. And the person you're working with, if you already trust them, they may not know anything about Parkinson's, but if they're willing to work with you and find out about it and see what your experience is, they don't have to be an expert in Parkinson's to be a good therapist for you. Thank you.
And you can also use the context of asking, when you're calling all those therapists, have you ever worked with an individual or couple who've experienced chronic illness, loss, grief? Those things can be very beneficial as well. The next question, I think, is a perfect one to ask all 3 of you, because I think it's a question that gnaws away and creates such internal struggle for care partners. So, Lola, I'm going to start with you. And so you can give this a yes, no, and you can elaborate. So here's just the very genuine question. Is it selfish of me to want or need a break to take care of me away from my husband who has Parkinson's? Is it selfish of me as a care partner? Lola?
I would say absolutely not. And in fact, it's a way to show that you care for your loved one. I know for myself that when I regularly take care of myself, I'm better equipped to help others. And I, like many, I'm sure, have examples of when I haven't done a good job of that, and thought that actually something happened just recently that I thought the idea of having a vacation away with my family was something that it was looking forward to and anticipating, that would be the fix. And as expected, well, maybe not as expected, but we had a actually catastrophic event that happened on that vacation. And so, having just that one opportunity to rest is not enough. It needs to be regular, so that you're better equipped to care for others. Richard,
is someone selfish if they need that break away from the person with Parkinson's?
Absolutely not. In fact, I want to focus on the word self. I mean, you have to take care of yourself first before you can take care of others. And I know that when that stress builds up, that there's just a lot to do. I'm not present as much. I'm not attentive, and that just sort of can spiral, not out of control, but can spiral with a whole different dynamic of frustration and a bit of resentment. My wife and I went to, my son was married in Normandy this past summer, so we had to fly to France, be in Paris for a few days, organize all that, then go up to Normandy for a wedding. So that was really stressful. Actually, I got sick because I really think that the stress of trying to keep all those pieces going was a bit much. And at a point when it felt real stressful, I would take a break. And my care partner says, you need a break. So there's also a bit of permission giving that goes on there. And I think it's incredibly important to be available and to be present to someone else, that you're present to yourself as well.
Absolutely. Dr. Santos, is it stress?
Well, I actually think it's more selfish to not take care of yourself, actually, because then the reason I say it's more selfish to not take care of yourself is because you kind of like are putting this have this idea that your worth is just taking care of the other person in the way you think that the other person needs to be taken care of, right? Where I completely agree with Lola and Richard that if you don't manage your own stress, things come out. It will anyway. It will either come out in that you get sick, right? You're blaming yourself or them for things that have nothing to do with them. It will come out. It will explode somehow. So it's more selfish actually to try to live up to some idealized standard of whatever you think caregiving is, or being a good care partner, right? You have to be a good care partner, take care of yourself. If you don't, that's very selfish, actually. You have to do that, to take care of yourself.
So let's brainstorm here for a minute, because there is a little bit of a follow-up question to that. And this sounds very familiar to some phone calls people have talked to. What if the person with Parkinson's doesn't understand that and doesn't, starts to kind of making you feel guilty about, what do you mean you need time away from us? It might be one of those situations where it's just an impossible. You can't necessarily make someone think something else. But once again, how do we support care partners' need to be to have time for themselves without getting into the blame game? What do we tell?
For me, I would say use your doctor. I actually tell people I am the one who is saying this has to happen, or I really believe that we're in a different age now, than maybe when I started, practicing, where I always say, I'm not here to be your friend. My role is to take care of you, and both of you, right? And I am saying, you blame me. She needs to go away. I'm telling you, you get pissed at me because she needs to go away or he needs to go away. And we talk about this really openly. Because I don't care, blame me.
Oh, that's great. We get the move the guilt or the blame, and you shoulder that, which is wonderful. A whole different type of caring by the practitioner. Let me ask, because once again, it's a question that's been submitted, and I have to say it's one that I have talked to numerous people about. Whenever whoever's on the phone with me is the person I'm focused on. So for care partners who have called and said, why can't I get my person with Parkinson's to exercise? We know that's going to make them better. That's going to slow the progression. Why can't I get them to go to the boxing or do this or do that? There is a huge amount of anger and frustration care partners experience. For whatever reason, the person with Parkinson's doesn't do what the care partner thinks. So let's talk about how do we get a little bit more comfortable with anger and resolving the fact that the care partner might ultimately never get the person with Parkinson's to do what the care partner thinks. How do we deal with that kind of back and forth?
I guess I return back to forgiving yourself, because at least I know for myself, I feel a lot of responsibility for offering information and making suggestions and having good ideas or whatever it is. And if I can't convince the person to participate or cooperate, I will feel responsible for that. And so I need to be able to give myself forgiveness for myself, in whatever that situation is.
Yeah, I would also add, and I'm going to make this as an assumption that there's a conversation at a time when the person's not angry, and you say, I'm hoping you will do this out of love because I love you and I want you to do as well as you can, as long as you can. Now, if your point is that even that hasn't worked, and I think back to Lola's point, there's a point where you say, I can't fix this, and I can't go carry around the guilt that this person doesn't want to do this. So I'm going to take care of myself because I know I'm going to be in for a maybe more challenging care process. So that's that acceptance thing I talked about, is at some point you just have to accept things as is. But I think the conversation has to come from not a point of not just blame the doctor or the research, but say, we know this is good for Parkinson's, and I want you to do this because I love you, and I want you to be the best person you possibly can for yourself and for me. And if that doesn't work, then it's acceptance, and then take care of yourself and try not to be as guilty as possible.
No, exactly. I completely agree. You cannot make anybody do anything. That's in any kind of situation, right? We can only educate people. We can tell them what needs to be done. But really, in their hearts, if they're not even willing to do it, and they're just going through the motions because, you kind of coerce them to do it, it's not going to work, right? If they go to these groups and, like, okay, lift their arms and do the things, but not really with intention, doesn't matter. If you can show that you're taking care of yourself and that you're doing something more active, right? Because you can only control yourself. Then you have to do it by example and help them through. Okay, so you're not willing to do this. I get it. And even if they do this, you might feel guilty. Well, we didn't do it soon enough, right? I take her. I didn't drag her along soon enough. I didn't make her get help soon enough. I didn't do this. There's all this guilt, and that's why it helps to talk with someone else about all the guilt and shame that you carry, because we can't make other people do anything, ever.
Right. No matter how black and white it be in terms of what the research says. And for caregivers in that position, they need a place to be able to vent that and to release that frustration and anger. So I want to take a moment to ask Richard and Lola, have you had any experiences with support groups, and have they been beneficial if you have?
Yes, I wouldn't say it's traditional Parkinson's support group. There's Annie would know this too. There's a group of us that have been involved in the kind of National Care Partners work, and that becomes a little support group, even on Zoom. But I find that we've got, fortunately for Chris and I, we have a group that's been connected spiritually for decades, and they're close friends, and they really become a support group. In fact, part of our process monthly is to talk about how we're doing just as people. So I would say, to me, that having my little communities of support is very, very important. And yes, there's an emotional response sometimes in that, which I think is incredibly healthy. And you get the response of a lot of support. Not people are going to fix it for you, but they're there with you on the journey, and that's so helpful. So I'm a big believer in it.
Yeah, I guess I would just reiterate of that, knowing that you're not alone, and also as a way to gain ideas for other strategies, to have people to bounce ideas off of or situations and talk through possible ways to cope, that can be really valuable learning from one another.
Yeah,
Absolutely.
I just wanted to add the group I mentioned. It's a meditation and contemplative prayer group, so you get the double benefit of very strong spiritual connection, but then also deepening your practice to keep yourself calm when when you need it.
Okay. So perhaps, once again, let's expand our horizons. It could be lots of different groups. Dr. Santos, what's your sense, your feeling about support groups? Yes,
Oh,
no?
they're great if people will, oh yeah, no, if you are one of those people who would benefit from the group, and a lot of groups, you can just kind of watch, right? You don't have, if you're not a joiner, you don't have to be like the one who's always talking and stuff. Just to
Right.
be in community with people usually help.
Right.
Now, I have a lot of people that I work with, they would never do that. They are, you know, very isolated. They never were with people. And this can be a problem, right? If it was just the care partner and the loved one, you know, together all the time, I say you don't have to join a huge group, right? You don't have to,
Right.
meeting a couple people, having, you know, 1-2 people that you can just, you know, have communion with somehow.
Yes.
Is okay. You don't have to be part of like a huge support group, but if you want to try it, I urge you. I mean, they really are very helpful, and the people, you can learn so much from being in a support group.
Absolutely.
And they aren't all the same. I feel like it's like shopping for a therapist, really. You can really try out different groups until you find one that you're comfortable with, because they come in all shapes and sizes too.
Absolutely.
Yeah, they don't have to
Just-
be about Parkinson's.
Yes.
Right.
Yes.
You could have a group just this is my group for exercise, or this is my group for grief, like in loss, or I just want a prayer group, right? And no one
Yep.
is doing
Absolutely.
anything else,
Yep.
but we're just being together. That's
Yeah.
fine.
Absolutely.
My wife has her Tai Chi group. She has her book groups, and they really become, they're more than just book group or Tai Chi. It's a support group. I mean, they're really growing
Absolutely.
close as friends. That's companionship piece, which I think is so important.
Sometimes the things that develop more organically can be as powerful, if not more. For our attendees, as we wind down here, we're getting really close to the top of the hour. I know I haven't been able to follow all of them, but I know we have shared a lot of links. And Dr. Santos has sent us a few more things that we will include in our follow-up email. So we'll make sure that we send you all of that. If you are interested in support groups, you know, this is a very, very turbulent time. Many support groups have stopped because of COVID. Some have transitioned to Zoom. Some have transitioned back to in person. It's really it just varies so much. Call our helpline. They will help you navigate that if you're interested in PD specific groups. And we try and keep as up to date list as possible, but things just change so dramatically, especially now. But reach out. That's, I guess, the main point here. And at this time, because we are just a few moments from the top of the hour, I know that we could probably talk for the rest of the afternoon, but I want to thank all of you, my panelists, for being here with us today. Dr. Santos, thank you so much for taking this time. I think you know how much we value your contribution, and this is so important. We really want to continue the conversation about mental health for care partners. Richard and Lola, thank you for taking the time from your day to be with us and to share your great knowledge and experience. And with that, I'm going to ask Erin if there we go. She is on the job. So I once again want to thank Dr. Santos. I'm sorry, Richard, we had Dick up there, but that should be Richard, Lola, and Annie. And thank you to all of you who have joined us. This time has just flown by. If we didn't get to your question, call our helpline. They will assist you in whatever way they can. Follow up with the links that we're going to send you. Reach out for that help. You deserve it, every bit of it, to take care of your mental health needs as much as your physical health needs. And we ask you, as always, to give us your feedback about the session today. We really value that and look at everything people tell us. You will receive a follow-up link to today's presentation. This has all been recorded, so you can come back to it. And I want to thank our sponsor for today as well, Kiowa Curran. Thank you so much for being with us. And if you have any other thoughts, questions, follow up with our helpline. Care Partner Town Hall will happen on Wellness Wednesday, November 17th. Tune in for that. You can carry some of this forward as well. At this point, I will just once again encourage all of you, take advantage of all the Parkinson's Foundation has to provide and offer. Go to parkinson.org. You can access just about everything we publish on our website. Call our helpline, 1-800-4PD-INFO. Email our helpline at helpline@parkinson.org. Again, thank you so much, everyone, for joining us today, and we look forward to seeing you at a future webinar.